Good afternoon. My name is Dr. Mark Smith. I'm the Chief Medical Officer here at Henry Ford Allegiance Health in Jackson, Michigan. I want to thank you for tuning in today for our media briefing. Henry Ford Allegiance Health and the Jackson County Health Department are coordinating our COVID-19 response, and we've opened up media briefings that will be regular to our community for updates. In order to ensure an efficient response to our media questions and support social distancing practices, this is a closed media briefing and will be sent over Facebook Live at this point. We've opened up a communication email portal for the media to send questions to us, and we will try to get those answered in real time during our media briefing. And again, that is we've already received some questions which we will be addressing today as well. This will help to ensure we keep our media and community up to date on a regular basis, and we will continue to have, again, regular media briefings, either written or by video as the time passes. At Henry Ford Allegiance Health, we value transparency, and it's important to us to provide you with accurate data as we are receiving it. And so, again, that is why we have opened up these communication portals. I have with me today Dr. Pamela Heckert, and I will have her introduce herself.
Hi, good afternoon. My name is Dr. Pamela Heckert, and I am the Medical Director for Jackson County Health Department, as well as an occupational physician here at Henry Ford Allegiance Health. So I would like to update everyone on the number of cases that we're seeing both in the county and in the state. Currently, there is still one case in Jackson County, and the person is recovering quite well at home. There have been no cases hospitalized here at Henry Ford Allegiance Health. The total number of cases as of yesterday at 2 p.m. is 334 cases in the state of Michigan, and that number is updated every day at 2 p.m. So right now we're about ready to update with the current ones, but we don't have access to that yet. So I will be letting you know each day as they come in new from the day before. And regarding whether or not there have been exposure sites from the one case that we do have, that's been a question that's been asked in the community. I'd like to explain for a moment how cases are handled through the health department. When we have a positive case identified, the Jackson County nurses, who are amazing, will actually contact that person directly. At that time, there will be a kind of an extensive interview with the person, and they will be asked exactly where they were, who they saw, and how long they saw each person for the 14 days before they became ill. That has been done with this case, so only the people who are actually at risk of exposure have been notified. Those people currently are now being asked to stay at home for 14 days, and if they develop any symptoms, they would immediately report it and get tested for coronavirus. People who are not having any symptoms are still in close contact with the health department and for any questions they may have and encouragement to identify whether or not there's anything they need because we just really do not want them leaving their homes. And then also in terms of return to work for the person who does have a known case of coronavirus, it's going to be determined with the health department. Again, working with both the nurses and myself, we will look at each person's symptoms, how long they've had the symptoms, and whether or not they have a fever. And it's based on those things that determine when they can return to work. For most people who have this milder form of coronavirus, that's going to be well within the 14 days.
Thank you, Pam. I would now like to turn it over to Dr. Courtland Kattan, and I will have him introduce himself.
Thank you. My name is Dr. Courtland Kattan. I am President and CEO of the Jackson Health Network, which is our clinically integrated network here in Jackson. I'm also Vice President for Population Health for Henry Ford Allegiance, and I'm the Medical Director for the Occupational Medicine Program here at the hospital. I was asked to address a few specific questions, mostly related to the drive-through location we have set up at 1 Jackson Square. I think the first thing to point out with the drive-through locations is that the goal there is to provide both screening and testing for people that have appropriately screened to be tested. So screening means that we ask questions. Those questions are designed based on CDC criteria to determine who may be at elevated risk for coronavirus. And then based on if somebody screens positive, we call it, then that person would be eligible for testing. And that testing involves a swab, which is used to push into the back of somebody's nose, and that swab then gets sent off to a laboratory to be tested. So the initial way we set up the screening was that people would just drive in to the parking lot at 1 Jackson Square. That could be done in person. We moved to a model that is much more efficient, and it requires that folks call in to what's called the MyCare Advice line. And with that phone call, they can be screened now by a nurse who's located here in Jackson, and then properly directed for the test if it's appropriate. So I was asked to share some numbers, and I just wanted to give that framing around what the numbers show. So the numbers are showing really how many cars are coming through the parking lot. Earlier on in the week, that number of cars reflected folks that were both being screened and tested. Now that number of cars is really just reflecting people that are being tested. Testing is not the same as being as having coronavirus. It is not the same as being positive for the disease. So when I provide a number for how many individuals have been tested, that doesn't mean that many individuals have coronavirus. I just wanted to make sure that was made really clear. So to give a sense of how many we see per day at the clinic on the drive-through at 1 Jackson Square, we saw just yesterday on the 19th 111 vehicles that came through that were scheduled to come see us. Of those, 84 were tested for COVID-19, so they were swabbed for COVID-19. Those results were sent out to an external lab for processing. And that means 27 individuals were actually just provided education because they did not meet the criteria from the CDC that required them to be tested that day. And we've also tested some of our employees. So we're taking the same approach with our employees that we do with the general public. We had 6 employees that we tested as well yesterday. That was just for one day. We've been up and running since Saturday, the 14th at 1 Jackson Square. In total, 760 cars have been processed through that testing location. We've had 407 individuals that have been tested or swabbed for coronavirus, and provided education to 357 additional individuals that came through the drive-thru. So again, I just want to reiterate what those numbers mean is that we've processed that many cars. We've processed the 754 cars. A large number were just provided education, and 407 were actually tested based on their screening. It doesn't indicate, the percent of people that have coronavirus or anything like that. It's just strictly based on those criteria. That's who we gave the test to. And I also think it's important to just reiterate that we're committed to making sure that anyone who needs a test based on those criteria in this community will be able to get a test. So I think it's really important to communicate that. There's no rationing happening. This is making sure we have utilizing the test for the most appropriate people who need it the most. So those are the numbers. I was able to, or asked to also give updates on test results. We have not gotten any test results back yet from that drive-through operation. We first started on Saturday. The expected date of arrival for even the earliest tests was about 7 days. And the reason for that is that nationally, as most people can imagine, there is a lot of demand for these tests right now. And so due to that demand, the results are just delayed coming back. There's only so much. There is finite capacity in laboratories across the country to be able to do these types of tests. So as soon as people's results come back, we get those electronically, and we make sure to share those immediately with individuals when we have them. I was also asked to address why it is taking so long. I think I've hopefully clarified that. Extremely high demand nationally right now. And then also to talk just a little bit about the screening criteria. So we started with really very straightforward screening criteria that were based primarily on travel. So had somebody gone outside of the state of Michigan within the last 2 weeks, we know the virus can incubate for about 2 weeks before somebody develops symptoms. Also, we're interested in whether folks had a contact or been basically close to someone that was a known case of coronavirus. That was pretty uncommon because we've had very few cases here locally, like Dr. Heckert already mentioned. And people needed to be symptomatic. So the main symptoms for coronavirus are fever, cough, and shortness of breath. So really those lower respiratory tract symptoms. So those are really the main criteria we started with. Given the need to really make sure we focus on individuals at higher risk, we've now added some criteria that are based on those risk levels. Older individuals, so over 65, people with chronic medical conditions such as diabetes or heart disease, as well as those who are immunosuppressed or on medications that cause immunosuppression. So those are a couple of the criteria, but we're really focusing on that population at this time to make sure the folks that really need the tests are getting the tests. So that's where we're at with that. The last question I had was just to address why are we not screening everyone in the hospital? And very simply is because everyone in the hospital doesn't need to be screened. Really based on where we're at from a public health standpoint, we understand that we just need to be testing people that have certain risk factors. And everyone in the hospital doesn't have those risk factors. The people in the hospital every day that are here for other reasons than being exposed to coronavirus or having a respiratory illness. So we don't need to test everyone at this time. So with that, I'm going to hand back over to Dr. Smith.
Thank you, Courtland. Some of you may have seen also on the internet or Facebook about the national concern with personal protective equipment, which is what healthcare providers use to protect themselves from bloodborne pathogens, and the coronavirus. So in preparation for that, we tasked our incident command to come up with a team to develop some prototypes for personal protective equipment, specifically surgical masks as well as face shields that could be reused in case we need to deploy them. The CDC website had made mention that there was prioritization of who can use PPE, which has changed recently as well, and we are preparing for that. We're very proud of our innovative team. Has come up with 2 prototypes that I'd like to show you now. The first is a surgical mask. So this is a moisture wicking fabric that actually has furnace filter material inside of it that can be removed, and then they can be washed and reused again. We also have a prototype for a surgical face shield that's basically plastic to prevent water materials from entering in front of your face. We've tasked this team to come up with a prototype to keep enhancing these prototypes, as well as working with our local businesses and fabrication companies to come up with these materials in case we have to use them in a shortage. These, again, will be reusable, washable, and can be used in an emergency situation. We also want to remind everyone to consult the CDC website for up-to-date information concerning how this is affecting us nationally as well as the state. And we will continue to do media briefings, whether written or in video, as the days go by. Please remember to be safe, wash your hands, socially distance yourself, and take care of yourself. Thank you very much.